Hey everyone, this is, and welcome back for episode 10 of CNY Conversations. I'm now in double digits in my episode, which is pretty exciting. I'm Jason Klink, your host, and I am here with Emilia Del Pino. Emilia is a clinical practitioner, easy for me to say, for the last 25 or so years. She specializes in the assessment and treatment of children's sensory motor-based oral motor feeding and speech language disorders. She has advanced training in assessing and providing treatment to children on several different oral and functional disorders, and has experience working with several different educators, providers, and children of all ages. So, Emilia, thank you for joining me here today.
Thank you. Thank you for having me.
So a little different format today. We're just doing an audio version. So the audio version will still be released on the different social media platforms, including Spotify. But Emilia, I wanted to have you dive in a little bit into your background and how you got into the work that you're in.
So I am a speech and language pathologist. I graduated Teachers College, Columbia University in 1996. After there, I had the opportunity to work with a multidisciplinary team at the Albert Einstein facility, Children's Evaluation and Rehabilitation Center. And through that exposure, I realized that I really do enjoy working interdisciplinary, looking at a child in a holistic perspective. So after that, I worked with Sarah Rosenfeld Johnson, who is the founder of Talk Tools, and she has principles and theories on speech motor learning and sensory processing, on how children use their muscles for speaking, breathing, and eating. And through that work with her, I went on to further study orofacial myofunctional disorders. And that basically, that scope looks at how the muscles of our face and our mouth coordinate with breathing and swallowing, sleeping, things that we do without even realizing it in our everyday life, the foundational skills of how to do that appropriately so we're functioning optimally.
So, and you work primarily with children. Am I correct in reading that?
Yep, I work with children probably from around 1 up through 18 young adults.
Okay. Now, are you going in and out of different practitioners' offices, or is the patients coming to you in your facility?
I have a home office, so families visit here at my home office for an evaluation. What I am doing more now is collaborating with different ENTs, dentists, orthodontists, and I have attended those visits. If a patient needs additional care in those domains, I do attend those appointments with families so that we can team build and have communication amongst everyone. And I'm learning from other practitioners how their scope impacts what I'm doing and vice versa. So it's team building, support for families and their children, and definitely continuing learning for me.
Awesome. Now, are you doing any work with school districts or specific schools?
I am working in different schools. Manlius Pebble Hill is a school that I have collaborated with for a number of years, and they've been wonderful. I have been on campus, and they are very supportive of providing a space for me to work with their children at school if parents prefer children to be seen at school. I'm also collaborating with them for a project in the fall to bring the conversation about airway health and wellness and sleep and how it impacts children holistically, not just their speech and communication skills, but academically, social, emotionally, mental health wise as well. So that's one school that's been wonderful and supportive. I have collaborated with other schools, and what has happened is if a school district is in need of my services, whether it's consultation services or providing evaluations or program plans, primarily parents reach out to me, and school districts then work together with me to set up a contract where I come in for the support needed for that individual child. But I have in the past provided superintendent's day, different lectures and supports for the speech and language departments of different schools in the area.
That's great. What are some of the I was just trying to think of what would be some of the needs that our school age children would have, or maybe the reasons or causes behind needing services like yours around Central New York?
Primarily, the students that are seeking support for my services, parents are concerned about speech and language delays, so skills of
Okay.
expressive language that are not commensurate with peers. Other times it's speech intelligibility and clarity, so their articulation skills. They might have errors, mispronunciations, things as common as a lisp or
Mm,
distorted R sounds to more involved childhood apraxia speech or phonological processes where children are simplifying their speech to a developmentally immature level when they're a little bit older. So we know that those skills, articulation, speech, and language, are very closely related to reading skills. And so we would like to intervene as early as possible to provide the supports for the children, the school system that they're in, and parents, so that we are supporting them with their overall communication skills, but also their reading and their writing skills.
that's interesting because, and ironically, we were just having this conversation with my family recently because my granddaughter is 19 months old, and my daughter's nervous, so she's not talking yet. We're like, oh, just you have time. She doesn't need to be reciting a book yet. Um, and kind of flip side to that is one of our nieces, she ended up needing speech help because after 2 years old she really wasn't communicating, wasn't speaking. Where's that fine line or that tipping point of it's just maybe a slow evolution into a small child speaking to they might need some help because they're behind the curve with a
Mhm.
certain age group.
That's an excellent question that often comes up. And when families have concern, they can reach out to their pediatrician, their local providers. There's early intervention, and they can have an assessment through the state. That's the birth through 3 population. When families reach out for me privately, I have a phone consultation, and through that consultation, I'm asking background, birth history, delivery history, early feeding milestones. So even when they're newborns, was there any trauma with birth? Was there any
Mm,
difficulty with mom during the pregnancy? How did they breastfeed if they were breastfed? If they weren't, was that by choice, or was there challenges with breastfeeding? And did they seek out support for breastfeeding? How was bottle feeding? How was that early growth and development? And what I'm seeing and what we're seeing in our field is children that might be slow to develop have had some difficulty with these early feeding milestones. And as they transition to table foods and they're going from the spoon fed purees to soft solids and even crunchy foods, we might see some red flags with what often is termed as picky eating.
hmm
And that too also has, common responses. They'll outgrow it. They'll eat when they're hungry. And the real reality to that is there might be an underlying sensory motor problem. So if a parent has concerns, I always say it's important to validate what their concerns are and to do a thorough case history, because we find a lot of information in speaking to parents and hearing their stories about what their child is having challenges with. And if we're seeing that there might be some early feeding development issues and difficulty with language acquisition, speech sound production, we would then recommend perhaps a hearing screening, making sure hearing is within normal limits, and ruling out or ruling in if there's some hearing issues. Then we would also do something called an oral placement, oral motor feeding assessment for children 0 through 3. And we look at those early feeding skills and how they're moving their tongue and their mouth, and how they're coordinating breathing and swallowing and chewing and all of that.
Okay.
So those are the things we would look at. And certainly the supports are there. So if a parent has concern, they should really reach out to their case manager and pediatrician to get some support for that.
And it's interesting that you ended with that. And one of the things I was just thinking of is I think we all find out, especially as adults, that when you get referred to a specialist or you try to connect with a specialist, it can be difficult and you can be booked out for months and months and months. Do you find that maybe parents don't know or they have a difficulty accessing services like yours?
Well, I'm trying to actually have the information in the conversation being highlighted. Recently, I did write an article for the Syracuse Parent page on this exact topic, warning signs of OMDs. It was through the Eagle Bulletin. And providing families and professionals resources that are available in the community is one of my goals. I think parents are not connecting the dots because it hasn't really been mainstreamed on how these domains really do overlap and they are very much interrelated. So I'm trying to provide awareness and education and help parents advocate once they have this information for resources. So the article was a first step. Going and collaborating in different orthodontists and dentists' office, ENT's office in Central New York, which I've started to do, is another avenue. And when families do find me, whether it's word of mouth or Google or just kind of coming across information on the internet, because there are many sites now that if parents are concerned with these areas of speech, language, feeding, and orofacial myofunctional disorders, they can type in the zip code and find practitioners on different websites in their area that have had this advanced training. So that's one way. And I'm trying to do more liaison work through a group called the AAPMD, the American Academy of Physiological Medicine and Dentistry. And there's a subgroup called the Airway Health Foundation. And through these organizations, they are really working on having professionals in the area in certain, in your local neighborhoods, really putting together study groups, information sessions, study clubs, things like that, so that individuals, both parents and professionals, can gain information. And I also have a lending library with families that do connect with me. I have books that they could loan out. I share research articles about evidence-based practice in this area. So I do that. I'm also very passionate about parent education, where I'm actually teaching the parents the skills to work on at home in between sessions if their child is working with me. So a lot of parent training and coaching and mentoring both professionals and parents is really what I feel is important, so that the families and professionals feel the resources are here.
And I think that loops back around to what you had described in your work of that holistic effect. And it's something that's very impressive to me is when you have some type of, either a practitioner or provider that is, embracing that holistic approach to the treatment of the patients that they're working with. And do you find that there's much more success in that type of holistic approach versus maybe one-on-one with a child or one-on-one with the parents and hopes that everything comes together?
I think we've seen it in our field that looking at a child in silos is really not working well because there's lack of communication between providers and teaming. And what
Hmm.
happens is, without that communication, we're just treating one domain and not looking at the root causes that might be impacting what we're seeing in my scope. So, right now, here in Central New York, tomorrow, for example, I have a meeting with an occupational therapist and a physical therapist, and I'm going to speak to them about my area, and they're going to share their scope and practice. Because if I'm seeing a child for an evaluation and I see some red flags of sensory motor issues, with that would be the OT, and physical issues, core strength and stability, I need to make sure that I have a team that I can refer the parent to, but also see if we could do co treatment sessions, or I can gain some strategies that I'm comfortable within my scope to include into my sessions to make sure that my sessions, the child is supported, whole body wise with seating and motor work. And if we're just operating in our own little boxes, we note that progress can be slower, and we might not be getting at the root cause of why there's some dysfunction or maladaptive compensations. We talk a lot about compensations in our field. With a child might be looking like they're functioning well, but what muscles or what other systems are over responsive in order to have them, function the way they're functioning.
Do you feel that a lot of, without the knowledge of services like yours, that a lot of, and this could be ignorant on my part, but I wanted to ask it anyways, is do you feel like a lot of medical providers would tend to throw medication at maybe a condition that a child might have versus seeking out specialty care like yours?
I really can't speak for other providers, but what I would say is we know in other countries that children are being screened for sleep disordered breathing issues, any
Hmm.
upper airway obstruction issues, whether that's going to an ENT or having a sleep study. And those are protocols that are in place prior to, let's say, diagnosing ADD or ADHD. I think it's important that, since many of those signs and symptoms are similar, that we look at the impact of sleep and quality, not just quantity of sleep, with children with any diagnoses. Um, I think we can be a little more proactive versus reactive in our medical care. Um, and having the openness to look at that. Um, I just feel like the more knowledge we have, whether practitioners are looking to go to multidisciplinary conferences, um, to just start the conversation of, let's go through the steps and make sure we're looking at all the domains that might be impacting um, how the child's functioning. So it's a hard,
Very,
hard question to answer, but
yeah.
I think um, we're starting to see the importance of looking at maybe asthma, allergies, gut
Mm.
health relationship to how the child's functioning, and sleep and airway issues. And we're also seeing dentistry and orthodontia, how important that plays into how ENTs might evaluate tonsils or adenoids. And, are we going to have surgery, or are we going to do some what we call expansion um, prior to having surgical procedures done? So it's really valuing everyone's scope and being interested in having these conversations that I'm trying to highlight.
I was just thinking how could a school district or educators, teachers, superintendents, outside of OT or PT type services, set up a program or access to services for school age kids that maybe needing that specific specialist type assessment and treatment versus the typical OT or PT services.
Well, not everyone would need this type of specialty. So,
Okay.
in this school age population, it's really working closely with the current OTs and PTs and, having in services and discussions if you're seeing some of these red flags. And the first really important thing to do is discuss screeners to be in place for kindergartners or preschoolers, so that just like we have early screeners for children in academics, we have these screeners. It's called the Fairest 6. And the Fairest 6 was developed by Dr. Sarush Zaghi out in California. And the screener looks at these 6 domains that might be red flags for these orofacial myofunctional disorders. So that would be a first part where the OTs, PTs, the nurses could start looking at a child and going through a screener. And they're not trained in this, expertise. This training really took, it was 4 years for me, but it could be up to 5 years from starting the coursework to different exams and on-site observations in order to become a certified orofacial myologist. And they would refer the patient to a provider like myself. But what we could do right now is get the information out about these screeners, so if families or practitioners see these red flags, they can then give parents that information to seek out a provider. So training them in the basic red flags, just like we have the screeners that we're doing in preschool and kindergarten, would be the first step.
Great stuff. Yeah, that's a super interesting. What so how are you getting your message out there? Obviously you're writing articles and you're creating your written content. Is there any other type of content or publications that people should be looking for with information you're trying to provide?
Families can go to the International Association of Orofacial Myology, the IAOM. There's a lot of information on orofacial myofunctional disorders on that website. If they're concerned about oral placement, feeding, and speech issues, they can go to the Oral Motor Institute. They certainly could go on the AAPMD professionals. There's a professional page there. The Airway Health Foundation and Airway Circle is another group that will have a parent portal. And there's upcoming conferences. The one I'm attending will be in Orlando, Florida in September. It's with the Collaboration Cures interdisciplinary conference with leaders in the field. They can certainly go to different podcasts. And what other things do I often recommend? And books. There's been a lot of wonderful publications, books like Sleep Wrecked Kids, Breathe, Tongue Tied, those are Gasp. Those are really eye-opening books, and that's really how I started my journey. Someone recommended a book based on what a family member was experiencing, and I read the book, and it was just very informative. And reading books and getting knowledge really empowers you to advocate for yourself and for your children. So I think those are the primary resources. There are many Facebook page groups for professionals, and there are many groups for parents who are seeking out supports, both in the Central New York area and then, throughout the United States.
Excellent. Great stuff. Well, Emilia, I appreciate you taking the time to jump on the podcast today. And it's amazing how quickly these conversations go through. But if any of the listeners wanted to connect with you, what would be the best way for them to connect with you?
They can reach out through my website. It's CNY Speech Pathology. They could go through the website. There's a Wix contact me form that they could fill out and reach me. My email is edelpino, slp@yahoo.com as well. And I look forward to speaking with any family member that would like to reach out.
That's outstanding. Well, once again, I thank you, and I appreciate you taking the time out of a busy day to jump on the podcast with me. Such great information, and I think it's services that parents or educators or even providers may not have necessarily considered in the past, and it may make a huge difference in some of what their children might be going through. So again, I thank you, and if any of the listeners out there want to connect with Emilia and you can't either find the website or can't manage to make the connection, don't hesitate to reach out. I'd be happy to share her email with you. And please share this with anyone that might get any value out of it, and especially the information Emilia had provided. Please share it with anyone. Drop a comment if you have anything specific you want to talk about in this episode or future episodes, because we're just trying to build up this community around the podcast for Central New York and kind of shine a bright light on a lot of the work that our great professionals that are doing around the area, work like Emilia's and others. So Emilia, again, I thank you, and I appreciate you taking the time.
Thank you for your interest. Take care.
All right. And with that, everyone, please take care of yourselves, take care of each other, and have a great day.